Welcome back. Now, malnutrition continues to be a devastating issue amongst children in the Omaheke region, with a rising number of cases. Last year, 45 children in the region died from malnutrition, and there were 132 recorded cases. Since the beginning of this year, 26 children have already died from malnutrition in the Omaheke region. In addition, a total of 300 children have been reported as malnourished, and 263 have been hospitalized. Joining us via Zoom from Gobabis to discuss this crisis is the governor of the Omaheke region, Pijoo Nganate. So good evening and welcome to the Daily Roundup.
Good evening to you and the listeners and viewers.
Just to start with, Mr. Nganate, talk to us about what the current malnutrition rates amongst children under 5 years old are within the Omaheke region.
Yeah, I think it's correct. Your introduction is totally correct. That we had from the beginning of the year up to date about 300 cases of malnutrition or malnourished children, and 260 over the period were hospitalized, and about 23. It's a small correction there. We reported earlier that it was 26, but in fact it's 23 deaths, which brings the reduction of malnutrition deaths to about slightly more than 50%. Now, that could be contributed to a number of things. Maybe the issue of malnutrition first, could be issues of hunger, yes, and poverty, unemployment, alcohol abuse, child neglect. And then, of course, we should not forget the devastating impact that COVID had on the population of Omaheke, because Omaheke was basically the epicenter, with more than 7% of people that have perished because of this disease. And as a result, many children became, for example, orphaned, breadwinners died, and those are some of the contributing factors that one could think of immediately, and also with the type of investigation that we have done.
How do the statistics for the Omaheke region compare to the national average?
In terms of COVID, yes, we were at 7%, and the nation was at 3%. So the Omaheke was the highest.
I'm speaking in terms of the recorded cases of malnutrition within children between the ages of 1 to 5.
Yeah, the recorded statistics countrywide that I have no knowledge of, and I am so actually engaged in my own story that I really do not even have time to compare myself to others. But I have an issue at hand that I'm dealing with that should give me sleepless nights. And it would be interesting to know how it is countrywide. But all I know is that Omaheke is the highest in the country when it comes to cases of malnutrition.
Talk to us about how the drought has affected food security within the region, and what specific measures are being taken to mitigate its impact on nutrition.
Yeah. Now, Omaheke is predominantly depending on livestock rearing, and of course, the drought have killed so many livestock, from small to large livestock, and those ones that did not die, the prices dropped drastically. People were being paid very little amounts of money for their livestock, even the ones that were in good conditions. And these things have affected the region very much in terms of economically, because you will remember that our families are, like, for example, the extended family. Now, if the breadwinner who's still alive, for example, cannot take care of himself, it becomes difficult to take care of other people. So in general, our cattle numbers dropped drastically.
Talk to us about the main challenges, Governor, that you're experiencing in delivering nutritional interventions within Omaheke, and what strategies are being explored to overcome these obstacles.
Yeah. No, thank you very much. I think one thing that I have to do is to compliment our healthcare workers, and we have about 40 of them running throughout the area of Gobabis. That is one of the epic centers. And these people are doing a very great job, because they fast track cases of malnutrition. They do measurements of these children. They report them immediately to clinics, and these children are then absorbed, for example, in hospitals. So that's one aspect that we can pat ourselves on the back, that we are doing our work instead in terms of capping these cases and fast tracking them. Now, we approached the Office of the Prime Minister, and the Office of the Prime Minister was very quick to act on behalf of government to give food distribution, to increase the number of beneficiaries, which are, for example, 22,000 households. And per the latest census, every house is having average 3.3 persons in Omaheke region. If you multiply 3.3 people per household, we're talking about over 80,000 people who are beneficiaries of this drought relief. And I must say that this drought relief do reach these beneficiaries. These over 80,000 beneficiaries, they are getting their meals. But we must also know that the people that we're talking about here are children between the age of 0 to 5. Now, children between the age of 0 to 5 can obviously not live from, example, the drought relief that government is giving. They need more nutrients. They need micronutrients. They need other things, proteins that can build their bodies. And that's where the challenge is. Of course, when they are admitted in hospital, their desired weight is regained, their lives are being saved. But then there is the issue that that child then goes back home, and back home it faces the same situation that landed that child, for example, in hospital. And that's where we have a problem. And we have designed a food system as the Office of the Governor to look at food systems. How can we, for example, do more nutritious meals, and also create employment for these parents of these children so that they can have an income and can start taking care of their own children. So the food system plan is in place. Land have been acquired from the municipality. Of course, there are certain things that still need to be sorted out. In the earlier, the permission that should be obtained from the ministry for us to go full force to production. But I'm also very much overwhelmed with support from the public. For example, commercial farmers who are coming on board and say, Governor, I'm having some milk cows. Can I give them to you? But for those milk cows to come, the land must officially come to our name, and infrastructure must be put up. My dream as governor is that this region used to be the region that was the dairy region. And we want to go back to that period when no one was actually getting hungry in Kobabes, because there was sufficient water, sufficient milk, butter was there, cheese was there, employment was created. And we want to go back there. Another thing that you should also consider is that the closure of the abattoir in Wetflay also contributed to more than 2,000 plus people being affected by the closure of the abattoir. So we do not have industries in Omaheke, big industries. We depend mostly from substance farming. But one thing that is also very commendable is that our people diversified their farming method, that they included crops now, and this office is being supported by communal farmers who are coming up with crops donations that we also give them to soup kitchens. By the time we discovered malnutrition, we barely had soup kitchens. Today, in a year's time, we have over 30 soup kitchens that we are supplying food for, and that are giving food to children, and not only to children, but also the parents who are in the neighborhood and who are in need of food. So those are some of the interventions that we have been doing. I just came from South Africa 3 weeks ago, where I went to benchmark in the Ekurhuleni municipality on the issue of micronutrients. And we are basically looking at the memorandum of understanding so that these experts of global head starts can come to Namibia, and in particular to Omaheke, and we can roll out these micronutrients and work towards putting up a production plant that will produce this.
Governor, 30
So
new soup kitchens is absolutely wonderful compared to, as you mentioned, last year when there were almost none. But this really seems to be a big crisis. If we look at the figures, last year there were 132 recorded cases. This year, 263 recorded cases since January. That means the figures have doubled in a space of 6 months. What are these figures possibly going to look like by the end of the year? So the question really is enough being done?
I think from the limited resources to our disposal, we are trying to do our best. And we also entered into a partnership with Hobabis Toyota that have given us a car. Now that car, for example, is going around into the region, disseminating information on issues of malnutrition, on issues of child neglect, on issues of nutritious food, and on issues of alcohol abuse. Because alcohol abuse is also another thing. And this thing is not only in particular to Omaheke, but to the whole country. For example, that you have local suburbs within the former Katutura, former Epako, where people unabatedly have alcohol outlets running from the morning till the next morning. And you could tell that during the time of COVID, there was less abuse of alcohol, less crime was committed, and maybe also as a country, we need to go and revisit some of those measures that were at play during COVID, so that we can also sort of reform our people in a way and regulate somehow behavior and over a long time educate, and eventually we may all be there. But it's a worrisome factor that the period in last year in terms of intake was lower than this year. In terms of death, it was higher than this year. So in terms of death, we have as government learned or actually shift the issue of preventing death by early detection. But then also we must take into account that there is only one district hospital in the whole of Omaheke region, this very vast region of 84,000 square kilometers, and only one hospital and one health center that is in Oshinene. So the rest of them are clinics, and they are over they are distance away, 200, 300 kilometers from the only hospital that there is. So not all our people are also mobile and having access to transport, and sometimes they do arrive way too late at health centers. But these are all things that we are aware of and that we are trying to work on and see how can we improve this.
Governor Nganate, we thank you for your time. We hope that when we check in with you a few months from now, we'll be hearing a bit better news for the region of Omaheke concerning this matter.
We must have better news. We definitely have to have better news, and we are not hopeless. We have hope. We arise from COVID, and we stood pride as a region. We diversified our food systems. We now have an issue of malnutrition. Some people are calling it a crisis. We are calling it a situation and a challenge that we should overcome. Of course, regrettably, we are losing children who are the most vulnerable members of society, but there should be light at the end of the tunnel, and we remain hopeful. I'm also happy that the president of UNCA earlier said about partnership, that partnerships are very important, and my office and the regional leadership, we believe in partnership, and we know that this malnutrition issue, we cannot overcome it alone, but we need everybody on board, and also people who are not from Omaheke, because these are Namibians and these are global citizens that are dying of malnutrition. Thank you very much.
That was Governor Nganate speaking to us from the Omaheke region concerning the malnutrition crisis within that region. We'll be right back after this.